Welcome to the state of Ohio. I'm Joe Ingles. Ohio lawmakers thought they had a shot on reaching agreement on a bill to limit vaccine mandates, but now they're back to working out the sticking points behind closed doors. House Republicans tried to fast-track a quickly developed bill that would make it easier to opt out of COVID-19 vaccine mandates with a vaccine or testing requirement for many companies likely coming from the federal government soon. The bill also sought to bring in elements of other measures that have been introduced on COVID-related policies, including bans on so-called vaccine passports. But the whirlwind process ended with leadership putting the brakes on the measure right before a potential House vote. Statehouse correspondent Andy Chow reports.
In less than 24 hours, a bill to codify exemptions to COVID-19 vaccine mandates was dropped in House Health Committee, received a quick hearing, was voted out of committee, and expected on the House floor. Republican Representative Rick Carfagna told the House Health Committee that the bill was a compilation of the different viewpoints legislators had heard over the last couple of months when it comes to COVID-19 vaccine policy.
This legislation is sensible and responsible. It empowers Ohioans by ensuring the availability of clear, unambiguous COVID-19 vaccine mandate exemptions. It balances personal medical freedom and protecting the health and the safety of Ohioans.
Anti-vaccine mandate groups have wanted a broad prohibition on requirements to get the shot in public and private sectors. But medical experts and private business advocates have said an all-out ban on vaccines, including the COVID-19 vaccine, would be devastating to public health. And the Biden administration is advancing a COVID vaccine mandate for all companies with over 100 employees. The bill from Carfagna and Republican Representative Bill Seitz would put into Ohio law 3 exemptions to COVID-19 vaccine mandates for students in K-12 schools or in private or public higher education institutions. The same exemptions would be extended to employees for private or public companies. Those exemptions are medical contraindications for people with an existing condition to which the vaccine would be harmful, natural immunity for people who have already had COVID-19 and can prove they still have the antibodies, and reasons of conscience for people who object to getting the shot for any reason, with a special mention of religious conviction. That final exemption raised objection from opponents of the bill. The measure only requires a person to write out a statement saying they're against getting the COVID-19 vaccine. Democratic Representative Beth Liston, a physician, says the legislature should be doing things to encourage people to get the vaccine and that this goes in the wrong direction.
And we're talking about removing tools that are important for keeping people safe. And while I am glad that the bill doesn't do everything, in terms of undermining public health, it doesn't undermine some of the masks and distance and other things that we know that works. It's still telling people, well, if you don't want the vaccine, all you have to do is write it down on a piece of paper, even if that's going to endanger others, and I think that's a problem.
Seitz addressed in committee the question of someone being able to object to getting the vaccine for reasons of conscience without a required explanation of that reason.
Implicit in any transaction is the obligation of good faith. So I would hope that folks claiming a religious or conscience objection would be doing so in good faith. I mean, were it otherwise, every person ever drafted to go off to fight in Vietnam would have been a conscientious objector and said, I'm not going. So, good faith is implicit in every transaction, and I would hope people would act in good faith.
There are exemptions to the exemptions. They would not apply to employees or students that work in children's hospitals, an ICU, or critical care units. Another provision of the bill states that the exemptions only apply to people employed in their current job at the effective date of the bill.
We're talking about the application of these exemptions to existing employees, people who are employed in their jobs as of the effective date of this bill. If that company is going to be hiring somebody after the effective date of the bill, and they do have a COVID-19 vaccine mandate in place, it will be applicable to that new hire without the exemptions. So that individual understands the terms of employment and can make that decision on their own whether or not to accept those terms of employment, knowing that there is a mandate in place for a COVID-19 vaccine. But for the individual who is already employed, who has been there for any length of time, now you're kind of changing the rules of the game midstream.
After an hour and a half of testimony, the bill was voted out of committee, bound for the House floor. Democratic Representative Allison Russo denounced the process, saying Republicans were rushing through important legislation.
I will just frankly say that this process is a huge disappointment. And I think having a bill that this committee only sees the text of 5 minutes before we start committee, that we have provided no opportunity for both sides of this issue, even people that I probably disagree with, the opportunity to come forward and testify on the various components of this bill, either for, against, or bring up issues. It's just a very bad way to make public policy, and I think is an insult to this institution that we...
As the vote moved closer, statements of opposition came out from influential business and healthcare groups. Even the Ohio Christian Alliance, which had sent out an email earlier in the week with instructions on requesting religious exemption forms or submitting letters stating objections to receiving the vaccine, said the bill needs further review. That opposition got louder with a statement against the bill from a group calling itself the Ohio Vaccine Coalition, which includes the Ohio Chamber of Commerce, the Ohio Hospital Association, and the Ohio Manufacturers Association, more than 100 businesses and other organizations. The group said the bill fell short of what the state needs in order to work towards recovering from the pandemic. Although House Republican leadership wanted to put it on the floor, they pulled it at the last minute, after members within the Republican caucus raised objections. The caucus has been split on the issue. Some want widespread bans on vaccine mandates, while others want more protections for private businesses to make their own decisions. Republican Representative Ron Ferguson says they're optimistic a consensus can still be reached.
435 has really taken a lot of the concerns of the caucus and the people of Ohio into consideration. And it's really close to being the bill that we need to protect employees, but it's not quite there yet. And I think that we're going to continue working on it to firm it up and make sure it's exactly the right step.
The legislation will be re-referred to a House committee. Andy Chow, Statehouse News Bureau.